So when should I get tested for HIV? I think that it is a complicated question, and a lot of people might be underestimating the benefits to getting tested and underestimating their risk. So let's go through it and talk about some of the recommendations that exist out there for when someone should get tested. First of all, baseline testing is generally suggested by the CDC for adolescents and adults at least once in your life. Whether or not you think you have risk factors or not, the general suggestion is that doing one test is probably a good idea just to make sure that you are safe and that you don't have anything that needs to be treated. Next, after that, folks who are higher risk are often recommended to get tested as often as every year or potentially multiple times per year based off higher risk factors. Those risk factors traditionally, and the ones that most people can list off the top of their head, are males have sex with males have higher risk factors, those who use IV needles, those who've had known sexual contact with someone who is HIV positive. Those are categories that most people tend to associate as a higher risk of HIV. But there's a couple that people don't often think of. One is if you've had a sexual partner who you don't know their sexual history and you don't know their tested, confirmed HIV status. That might be a reason. Another reason is if you've tested positive for another sexually transmitted disease. If you've tested positive for gonorrhea, chlamydia, it might be a reasonable idea to also get tested for HIV at that time frame, or if you have a suspicion and you're going in for testing, to just get sure and make positive that you do not have an HIV issue. Now, don't forget, there's a testing window depending on the type of test that you're using. So if you think you were exposed on a Tuesday, going in on a Saturday to get a confirmed I didn't get HIV from that exposure test would actually be a little bit too early. Might not be a bad idea to make sure that you didn't bring HIV into that exposure yourself, but you're going to need to get a confirmatory test farther down the line once that testing window is over. Two other things that mean you might need to get HIV tested that people don't often think about include if you get pregnant. Pregnant folks should be tested for HIV to make sure that they are doing all the things that they can to protect themselves, as well as those who come up with diseases or other infections, not even necessarily sexually transmitted, that tend to only happen in folks who are immunocompromised. One of the classic things that I think of is someone who comes, an adult who doesn't know that they have any other illnesses. If they get oral thrush, thrush is a fungal infection, candidiasis. If you get oral thrush, generally it's suggested to consider an HIV test as well to make sure that you do not have an undiagnosed HIV infection causing an immunocompromised state, because oral thrush is known to be more common in those with an immunocompromised state. Remember, talk to your doctor about any particular suspicions that you have, and when in doubt, I generally would go ahead and suggest a test, because you always want to be sure, you always want to be safe, and you always want to be getting the medical care that you need.